In this video, I'm going to be going through the basics of oral health care. We do have other videos on this topic. In the description, there's a link to the playlist. We brush our teeth twice a day, every day, to help maintain a healthy oral cavity. We should brush our teeth for 2 minutes at the beginning of the day and right at the end of the day. After we brush our teeth, I recommend you don't have anything to eat or drink apart from water overnight. Children up to the age of 8 need adult supervision because they don't have the manual dexterity to be able to brush their teeth correctly themselves. It's important to use a pea-sized amount of toothpaste, and children of different ages can have age-appropriate toothpastes as well. You should use flossing or interdental brushes before brushing your teeth to help clean in between your teeth. If you don't brush your teeth twice a day, you can end up with problems in your teeth, such as cavities and gum disease. It's fine to use an electric or a manual toothbrush. Both work equally as well. However, electric toothbrushes tend to be less technique sensitive. There's many things to look out for in a manual or electric toothbrush when you're going to buy one. It doesn't necessarily have to be the most expensive one. If it's a manual toothbrush, you can make sure it's got soft bristles or even medium bristles. Hard bristles not necessarily very good for the enamel on your teeth. And if it's an electric toothbrush, you should look out for a pacer, a timer, and pressure sensor. Again, it doesn't have to be the most expensive one. Quite a lot of basic models have got these features as well. Electric Teeth have got other videos that can help you choose an electric toothbrush. Be wary of fad or mouthpiece toothbrushes, which may seem like they could save you time. However, they tend not to be as good as the traditional electric or manual toothbrushes. Interdental cleaning is cleaning out the debris in between your teeth. It's important to do this because your toothbrush doesn't actually clean right in between your teeth. So after brushing your teeth, you can be left with debris in between your teeth that needs to be removed with interdental brushes, flosses, or water flossers. Interdental brushes are small brushes you can use to clean in between your teeth. Interdental brushes come in different sizes depending on the size of the gaps in between your teeth, and they can help to remove debris from in between your teeth to help to maintain gum health. When you start using interdental brushes, you may find that your gums are bleeding, but with regular use, your gums will become stronger and healthier and stop bleeding. If your gums have receded, you can clean your teeth using your traditional toothbrushes and interdental brushes. You have to choose the correct interdental brush size to fit the gap of your receded gums. When you first start to brush your teeth or use interdental brushes, you may find it's a little bit uncomfortable and your gums may bleed a little bit. The more you use it, the healthier your gums will become. Your dentist or your dental hygienist can help you choose which is the correct size interdental brush for you to use. You should floss or clean between your teeth at least once a day, but ideally twice a day. I recommend flossing before you brush your teeth so it removes the debris in between your teeth, and then you can brush that debris away. Using floss can be very technique sensitive, as the floss can be difficult to wrap around your fingers and move around your teeth. Interdental brushes are less technique sensitive. You have to choose the right brush size to go in between your teeth, and it's easier to move in and out in between your teeth. So you may find interdental brushes easier to use than floss. When it comes to choosing a toothpaste, there's lots of different choices. Try and use one that's appropriate for your age. So if it's a children's or an adult toothpaste, try and use one that's got fluoride in there, or if you don't want fluoride, then hydroxyapatite. If you don't want to spend lots of money on a toothpaste, that's absolutely fine. You can just use one with those basic ingredients in there. And if you're not going to, or you don't have toothpaste at all, then you can just brush your teeth without toothpaste using the mechanical removal of debris in your teeth. It is best to use a toothpaste that has got those ingredients in though. With whitening toothpaste, try and use it sparingly because it can be abrasive for your teeth. So be careful when you're choosing a whitening toothpaste and try and use it as carefully as possible. Whitening toothpastes actually remove the external stains on your teeth. They don't actually whiten the base colour of your teeth. If you want to whiten the base colour of your teeth and change the colour, you would need to go and see your dentist and have a tooth whitening procedure done. After you use toothpaste, spit it out, but don't rinse your mouth out afterwards, and try not to use a mouthwash straight after brushing your teeth with toothpaste. This is because the fluoride levels in your mouthwash are a lot lower than the ones that you'd find in your toothpaste. It's best to use a mouthwash at a different time to brushing your teeth, so perhaps after lunch or dinner. You can get special mouthwashes to help with certain mouth diseases such as dry mouth or gum disease. You can get mouthwashes with or without alcohol. Best time to brush your teeth is at morning time and last thing at night. It's easier if you set it into a routine from a young age for your children, so they get used to waking up in the morning, brushing their teeth, and brushing their teeth last thing at night. If you're not used to brushing your teeth in a routine, then it's good to make small changes until you get used to making it part of your routine. Also, changing your toothbrush head or changing your toothbrush regularly is good to be part of that routine as well. So it's good to change your toothbrush head every 3 months or sooner if it becomes worn out. There are other things that you can use to help yourself get into a good routine, such as brushing charts, reminders, timers on your phone, and apps and reward charts to help you. You can use Plaque disclosing tablets to help you identify areas of your teeth that you're missing when you're brushing your teeth. So you take a tablet and you chew it and you spit out the remains. You can then see inside your mouth areas that have got plaque on them. You can then proceed to brush your teeth and brush away these areas, and it gives you a good idea of areas that you're missing when you're brushing, and it can highlight areas that are particularly difficult to reach. So once you get into a routine of using these and identifying high risk areas, you can then get used to removing plaque effectively from these areas. You can then check your mouth at the end of your brushing routine in the mirror and make sure that you've removed all the dye off of your teeth, and make sure your teeth are nice and clean. Doing this over a period of time will indicate to you areas that you're missing regularly and help you achieve better gum health. Bleeding gums can be very common, but it's not normal. If you see that your gums are bleeding, you must go and visit your dentist to find out the reason why. Ways to prevent gums from bleeding can be to have really good brushing and oral hygiene techniques. Flossing your teeth using interdental brushes or a water flosser can help prevent gums bleeding. There's different reasons why gums can bleed. For example, you can get pregnancy gingivitis when women are pregnant, or a change in hormones. Certain medications can make gums inflame. Certain conditions when you're immunosuppressed, when you're not well, when you have flu or a cold, things like that can cause bleeding gums or make your gums be more sensitive. Giving up smoking and alcohol, having a really good oral health routine, and visiting your dentist regularly can help prevent bleeding gums. Genetics can predispose you to having gum disease or periodontal disease as well. But really, most of the time, if your gums are bleeding, it's possibly because you're not brushing them correctly, or there's debris left next to your gums causing gum inflammation. If you go and visit your dentist, they'll be able to help you combat this and tell you ways to help to prevent gum disease. Hormonal changes, not cleaning properly, missing areas and leaving debris next to your teeth and gums, not flossing, genetics, some medication, smoking. Treat bleeding gums by brushing regularly, brushing with the correct technique, flossing and interdental cleaning, using the right toothbrush and tools, healthy diet, drinking water, regular dental visits, considering your medication, quitting smoking, reducing stress. If they are still bleeding, see the dentist. Some people may worry about bad breath. The best way to get rid of bad breath is really good oral hygiene routine. So good brushing for 2 minutes twice a day, good flossing or interdental cleaning. Other things that can cause bad breath are things in your meal. For example, if you've had something with garlic, and the best way to combat things like that is to, again, have really good oral hygiene, brushing and flossing. You can drink lots of water afterwards, or you can use mouthwash after a meal to help to freshen your breath. Some of the other causes can be things such as gum disease, cavities, smoking, drinking, being dehydrated, or it can even be problems coming from further down in your stomach, such as stomach ulcers or indigestion and other such problems that you can consult your doctor for. Your tongue plays a really big role in bad breath. The texture of your tongue is uneven, so you can get bacteria stuck in the pits and grooves that are within your tongue. This can cause odours over a period of time. 50 to 90% of bad breath can be tracked to residue on your tongue. It's very important that you clean your tongue regularly to remove bacteria from your tongue to help to prevent bad breath. Drinking water can really help with bad breath. Being dehydrated is a big reason why people may have bad breath. So drinking enough water regularly, and especially after meals, can help with bad breath. If you're fasting, then ketones in your bloodstream can give you bad breath as well. So if you're fasting, then have regular water if you're able to, and have excellent oral hygiene to help to combat this. It's fine to use mouthwash sometimes after a meal to help with bad breath. But if you have regular bad breath, it is important that you go and visit your dentist to find out the cause of it. Occasional bad breath is if you had bad breath perhaps first thing in the morning, where you've not had water overnight, or after a meal. But chronic bad breath is something where you get bad breath all day, every day, or very regularly. And if you do have chronic bad breath, do go and visit your dentist to find out the reason why. Please go and see your dentist before you have any cosmetic treatment. Things like tooth whitening or cosmetic enhancements to your teeth do rely on having healthy teeth to begin with. It's best to try and keep your own teeth healthy and in the best condition for as long as you can, rather than having them all drilled down and having invasive treatment done, because all the treatment has an end date as well. So if you have crowns done after a certain period of time, they may need to be redone, and you have to wonder how long it's going to last and how much it's going to cost you in the long term. Be warned that if you're going abroad to have dental treatment done, make sure that your teeth are healthy before you go ahead with any treatment, and check with your dentist to double check the treatment plan to make sure that it's a healthy treatment plan for your teeth and it doesn't involve destroying your teeth for cosmetic enhancements. There are lots of non-invasive ways that you can improve the looks of your teeth, things like braces such as Invisalign or traditional braces or clear aligners, teeth whitening and composite bonding. It's important to educate yourself about the type of treatment that you're having done. For example, many people go abroad to have things like turkey teeth, where they think they're having something like veneers, which is minimally invasive, but in fact they end up with teeth being drilled down to a minimal amount of tooth left or to stump shapes. If you have something like this done, that's committing you to a lifelong commitment of having replacement crowns or further problems with your teeth like root canals, and it may even lead to tooth loss. And please make sure you ask lots of questions before committing to anything. It's important to have a healthy lifestyle and diet for the health of your teeth and your general health as well. Eating things like apples, greens and cheeses can help neutralize your mouth and their natural tooth cleansers. Other things such as sugary drinks, high-fat drinks, acidic drinks and foods can be very damaging to your teeth. If you are going to have those things, try and have them all in one go rather than snacking on them throughout the day, because that will mean multiple acid attacks on your teeth that puts you at higher risk of decay and gum disease. Please make sure you maintain a good oral health routine to brush and floss your teeth well, and leave it at least half an hour after you've eaten before you go and brush your teeth. Smoking and alcohol are bad for your teeth. Smoking can cause gum disease and stains on your teeth and the yellowing in teeth. And alcohol can erode the top layer of your enamel away as well. So both of those are very bad for your teeth. Drinking water is good for your teeth and your general health. It can wash away stains and bits of food in your teeth, and it can help to keep your teeth hydrated. So drinking lots of water throughout the day, especially after meals, can be really helpful. It's important to visit your dentist regularly. Routine dental checkups are at different intervals for different people. For example, if you have lots of problems with your teeth or gum disease or underlying medical conditions, you may need to go and visit the dentist more regularly than somebody who doesn't have any problems with their teeth, who may be able to leave it up to 2 years in between dental visits. It's good to go and see your dentist so they can pick up any problems you have nice and early to help prevent problems getting worse and keep your mouth nice and healthy. Dentists can help with several problems such as swollen gums, loose fillings, loose teeth, pain in your teeth, ulcers, and other conditions in your mouth as well. They check your oral cavity, including all the soft tissues like your tongue, your gums, the inside of your mouth and inside your lips, as well as your gums, any bleeding gums, your teeth, and any teeth that may be loose, that are about to fall out, or for children, any teeth that are coming. It's important for people who wear dentures to see the dentist as well. They may think because they have no teeth, they don't need to see the dentist, but dentists can check the oral mucosa inside the mouth, make sure that there are no ulcers, make sure there's no rashes and conditions inside the actual, on the skin inside the mouth, and they can check the dentures to make sure they're not loose or broken or rubbing in certain places, and double check on your denture wearing routine. For example, making sure that you're taking your dentures out at night time, make sure that there's no thrush or any red areas or patches underneath your dentures that can get worse and cause more serious conditions. NHS dental treatment is available for most people in the UK, so you can go onto the NHS website to try and locate your nearest NHS dentist. It's very common to be anxious of visiting the dentist. However, we do recommend that you go and visit your dentist initially just for a checkup, which is usually mostly a chat and a catch up about your teeth to find out what problems you have, and then to discuss the possible treatments. If you let your dentist know that you're anxious, they can allow for extra time to be able to go through things with you and explain things. If you visit your dentist regularly, they're able to pick up any problems with your teeth nice and early, and that can actually mean that they can catch it before it becomes a big problem, and it can actually end up costing you less as well. Book in to see a dentist if you experience any pain or changes in your dental health. Red, tender or swollen gums, gums that bleed when you brush or floss, gums that begin pulling away from your teeth, loose permanent teeth, changes in the way your top and bottom teeth align with each other, unusual sensitivity to hot and cold, persistent bad breath or an unusual taste in your mouth, changes in the way your dentures or partial dentures fit, difficulty swallowing, mouth ulcers or sores that don't heal. There are lots of common mistakes that people make when they come to their teeth. Here's a list of a few. Don't brush your teeth for long enough, brush too often, brush too soon after food, brush with too much pressure, don't brush with the right technique, using an old toothbrush, using a hard bristled toothbrush, using too much toothpaste, rinsing after brushing, forgetting to floss, forgetting to clean the tongue, eating the wrong foods, not visiting the dentist regularly, chewing only on one side of the mouth, not considering braces as an adult, not teaching kids to take care of their teeth properly,